Okay, moving on to the bottom jaw. So I have rolled my cat over on his back, so he's now in ventral. The towel you might need to put underneath the shoulders and really make that head flop back a little flatter. I'm having trouble with this little thing getting him super flat, but the flatter you can get him, the better. I flipped my sensor over, so now my flat part of the sensor is facing the teeth, okay, the bottom jaw. I'm going to start on the bottom left. Sometimes you got to orient yourself. Left is on this side now. And we're going to go for the whole bottom jaw. So again, from molar to canine. So again, I'm going to find my angle, looking down at the sensor, looking in at my teeth. Sorry, you guys can't see. Sorry, I should be like this. Looking down at my sensor, in at my teeth, and finding that right angle, okay? And then moving it in, centering it over the jaw. Sometimes you got to move your cat a little bit. Again, you want your teeth to be kind of in the center of the cone so that you can hopefully get that root system. I've already selected it on my computer, so all I'm going to do on my control panel is switch this to lower, and that drops our MAS down just a tiny bit because those bottom teeth are a little smaller. We're going to get 6 feet out of the way, expose, and wait for the computer to load. So not too bad here. I did cut off things a little bit, so I'm a little high. I think I need to drop my angling down just a little bit. So I'm going to just drop that down. Make sure I've got that back molar. Let's try that again just to see if I can clear that up. Okay, well that was worse. It's okay. So again, troubleshooting, trying to figure out your angles. Sometimes this would be just getting his head a little bit flatter, maybe moving my beam down a little lower or a little steeper. Obviously whatever I did was the wrong thing to do, but we're going to keep moving. So I'm going to move to the front center. So canines and incisors, again, kind of the same thing, making sure it's kind of squared. Make sure it's out in front of your canine and incisors just a tiny bit. Finding your angle. Look down at your sensor. Look in at the front of your teeth. That doesn't look too bad. And then again, center kind of over the middle of the bottom jaw. The canines are long in the bottom jaw in cats, but not nearly as long as the dog. So usually you can kind of just angle it in there. And then make sure the kitty cat's kind of in the center of my beam. Make sure it's selected on your computer for that location, and then expose. Okay, great. We'll look at that a little bit later. So we're going to move on to the bottom right, basically shooting it the same way we did on the other side, moving it around, making sure our sensor, we might need to slide it this way just a tad, so that we're picking up those teeth. All right, let's see. Look down at this, look at this. So I'm going to need to go up here. So I think I may have been a little low on the other side. Let's try that. And we're going to expose. Let's cross our fingers that it works. Much better. Yeah, I was a little high on the other side, and I just didn't take the time to troubleshoot. So, much clearer. You can see now the base of the canine and all these teeth here, so that's a great x-ray. Okay, so the last view I'm going to show you is the other way to get the upper maxilla views on a cat. Because these zygomatic arches are so big, like I showed you in the other view, sometimes they're in the way of what you need to see with the roots. So most of everything we've taught you so far has been what we call intraoral x-rays, which is putting the film inside the mouth. This view is a different type of view, and it's extraoral, which means the film is on the outside of the mouth. This is not typical in dentistry x-rays, but it is something you can do periodically to get a different view. So what you're going to need to do, I have my cat here, it's a little easier on a live patient because they have the body with them to position. You're going to need a mouth gag. And so what I like to use is these little syringe caps. So it's a syringe, or a needle cap. It's a cap of a needle, so I've taken it and I've actually cut the end of it off to make it shorter. And they have really good indentations, and they fit right on the cat's canines, usually pretty easily. Can you see that? So that's just a nice way to prop the mouth open. It doesn't have a spring action, so it's not putting pressure on that jaw to cause any issues there. It works on small dogs as well, and the nice part is you can throw it out when you're done. It's clear, so it doesn't usually show up that much on an x-ray, so it wouldn't interfere. So what we're going to do is we're actually going to put the film underneath the head. So I'm going to x-ray the upper right quadrant this time, just to kind of show you again. So I'm going to lay the film on the blanket or towel, whatever. Okay, I'm going to lay the head. Let's see if I can move this closer, so you guys can see a little bit better. So I'm laying the head on the film, okay? And I want to make sure the whole quadrant fits on there. I'm going to have to do this kind of in an oblique view, so I'm going to have to tip the head. If you do it straight on, you're going to get both upper maxillas superimposed over each other, and then you won't be able to see the difference. And I may have to use this towel to kind of get him where I want. So I've kind of rocked him in there. Maybe have to rock him a little bit more, hoping that he doesn't fall over. Okay. Let me see if I can get a better view here. Can you guys see that? So we're looking at the lingual surface now of the tooth. All right. The beam. You're still going to do this at a 45-degree angle, but it's kind of guessing at this point because you can't really get in there to do your angling. So I'm just going to guess that it's about at a 45 to those teeth, and I'm just going to point it at it and hope that I get them in there without moving my head too much. It's kind of tricky. Like I said, it's a little easier to do on a live patient. All right, let me shoot this and let's see if it comes out. Okay, so it's okay. I'm a little crossed over, but not too bad. So what I'm looking at here is these teeth. So I can actually see them. So what I've done is I've put the arch on the back side of the teeth, so now it's not really in the way. So I can actually see the outlines of these roots a little bit better. So if you're worried about a dental disease at the root tip on any of these teeth, this is the type of view that I would take on a cat or even a small dog to get that view to come out. So that being said, small dogs, I treat them like cats. So any dog that's about the size or the head size of a cat, I would treat as a cat. So your little miniature chihuahuas, teacup poodles, things like that, I would do their x-rays very similar to a cat. You may have to take 2 views of each side quadrants just because they have more teeth that you need to examine. But I would do the same setup as far as in sternal and then in ventral. You can do that technique for large dogs as well. You're just going to be taking multiple views. So giving you some flexibility here so you can kind of move things around and kind of do things the way that you want to do. There's no 100% perfect way to do dental x-rays. You can kind of take it and twist it on however you'd like to do it. I hope this video is helpful. Hopefully now you can have an idea of how to approach feline dental x-rays. And I will do a separate video for evaluating dental x-rays.